Hello guys, welcome or welcome back to my YouTube channel. My name is Harusnet Gaki, and in our today's quick lessons, we'll be learning about low blood pressure. We will be having a lesson on what is low blood pressure, the causes, signs and symptoms, and how to manage it. So in my video today, it will be more of explaining or teaching rather than actions. So be attentive, learn something, and share with the rest. So let's start with the introduction of low blood pressure. So what is low blood pressure? Low blood pressure is generally the blood pressure reading lower than 90 millimeters of mercury for the top number, or 60 millimeters of mercury for the bottom number. And the top number is called the systolic pressure. And this is the pressure in the arteries when the heart beats. And the lower number is referred to as the diastolic pressure. And this is the bottom number, is the pressure in the arteries when the heart rests. So remember, what is considered as low blood pressure to one person might be okay for the other person. So let's get to know the signs and symptoms of someone who has the low blood pressure. So sign number 1 will be dizziness. Number 2, you'll find the patient complaining of headache. The patient may also end up fainting. There is fading vision. There is nausea and difficulty in concentrating. So you'll find the patient may not be concentrating. So let's get to understand what are the causes of low blood pressure. Cause number 1 could be lack of nutrients in the diet, low level of vitamin B12 and iron. Cause number 2 could be severe allergic reactions, which is also known the anaphylaxis. It can also be caused by severe infections. This is when the infection in the body enters bloodstream. Blood loss, either from injury or internal bleeding. There is dehydration, when body doesn't have enough water. Also, it can also be caused by heart attack or in case of pregnancy. So, how do you get? Let me also take you to another quick lessons to know different types of low blood pressure. There is type number 1, which is called the orthostatic hypotension or posterior hypotension. This is the sudden drop in blood pressure when standing from a sitting position or after lying down, and it can be caused by dehydration, long-term bed rest, pregnancy, and also certain medical condition. And this can mostly occur to older adults. There is another type which is called the postprandial hypotension, and this is the low blood pressure where it mainly occurs 1 to 2 hours after eating. It mostly likely to affect older adults, especially those with autonomic nervous system diseases like Parkinson's disease. Such patients should practice eating small, low carbohydrate meals, drinking a lot of water, and avoid alcohol. There is number 3, which is neurally mediated hypotension. And in this case, the pressure lowers after standing for a long period of time. This mostly affects young adults and children. And this may occur as a result of miscommunication between the heart and the brain. There is also another one which is called the multiple system atrophy with orthostatic hypotension. This is also called the Shy-Drager syndrome, and it mostly affects the nervous system that controls involuntary functions. So now let's get to know how to deal with the natural ways to deal with the low blood pressure. So number 1, love to take strong tea. Strong tea helps in normal low blood pressure resulting from low cortisol levels. Number 2, pay attention to your body positions. For example, Don't get used to sit while crossing your legs. While sitting increases the blood pressure. Number 3, eat small low-carb meals to help prevent pressure from dropping sharply after meals. Eat small portions several times a day. Again, limit high carbohydrates foods such as rice, potatoes, bread, and also pasta. Number 4, try to drink 1 or 2 strong cups of caffeinated coffee or tea with breakfast. Don't drink caffeine in the day because you will become less sensitive to it, and this can cause dehydration. Number 4, eat adequate salt. Excess salt is not good, but again, it's required by the blood in moderate quantities. It also eat with high salt content to increase your blood pressure. These fruits, they are like olives, cottage, cheese. Also, adding table salt in your food is allowed. Number 5, drink a lot of water. That is 2 to 3 liters of water daily. Also, coconut water is very useful to such patients. Remember, daily dehydration is the common cause of low blood pressure. And number 6, wear compression stockings. That is the elastic stockings or socks. Can help in preventing blood from pooling in your legs. Did you know that? Did you know that? So guys, that's all I had for today. Thank you for listening to me. Was my lessons educative? Was it of any importance? If it was, kindly let's meet on the comment section, and also remember to share with the rest so that they get to learn. Thank you.